Hi, my name is Doug Thompson, and I'm a new medical oncologist with Blue Ridge HealthCare. I've been here now for approximately 6 months. Just finished my fellowship at East Carolina University. I am a little bit different than the typical oncologist in the sense that I was a general internist, primary care doctor for 11 years before I decided to go back and specialize in hematology and oncology. My reason for doing that was a lot of the changes that I saw during the time I was in practice as a primary care doctor with improvements in what we can do in cancer care now. I had always had an interest in it, and I had gotten very close with many patients I had diagnosed as a primary care doctor, but ultimately would turn their care over to an oncologist when I would diagnose them, and didn't really get to be as involved in their treatment. But when I started thinking about all the new changes, I said, well, it would be really a nice thing to go back and specialize and be the person that actually cares for the patient and follows them through for their treatment. I've always known since I was young that I wanted to be a physician. I'd always loved science and also loved people and the interaction with people and taking care of them. And so all through grade school and high school and on into college, I knew I wanted to be a physician, and I would be actually the first physician in my family for many, many generations. We had a lot of engineers in the family, but no physicians. And so I went to medical school. Then you had to decide what specialty I wanted to go into, and I really loved general internal medicine because number one, you're a primary care doctor, you get to have a close relationship and continuity of care with your patient, but you also get to see a lot of variety of disease and know a lot of different areas. And at that time, specializing didn't interest me as much, but I always said to myself, doing general internal medicine will always give me the option in the future to specialize if I want to. So I did general internal medicine, like I said, in Beaufort, South Carolina for 11 years and really enjoyed it, but a lot of things changed over that 11 years, one of which was some of the expectations of a general internist changed in the sense that most doctors were either becoming a pure outpatient clinic type setting and giving up their inpatient privileges, or they were becoming a hospitalist where they were only doing inpatient care and not seeing their patient in the office. And neither of those really appealed to me. I liked to have the relationship with my patient where I would see them in the office and in the hospital and have that continuity of care. I had been interested in oncology, saw the new exciting drugs and therapies that were out there. It made sense that I could go into oncology where I would still sort of be the patient's primary care doctor during the time I was treating them for their cancer and be able to continue to follow them with their care, whether they were in the hospital or in the office. And so that's a big part of the reason why I went back. And some of the things that we have now that we did not have just 10 years ago, a lot of targeted therapies now for cancer care. We still use general chemotherapy to treat patients, but we also have a lot of targeted agents, both in IV and oral form, that allow us to specifically treat the person's cancer and to lessen a lot of the toxicity and side effects that we associate with chemotherapy. This has really revolutionized how we treat many cancers, and in some cases we've turned deadly cancers such as chronic myelogenous leukemia, which other than a transplant didn't have a really good chance for cure, into now a chronic disease that we treat with an oral chemotherapy medicine called Gleevec just once a day. It's very well tolerated and really has changed the whole prognosis and response rates with that. So things like that are really what got me excited about going back and doing the fellowship and training in this field. Well, I would say overall life has improved dramatically for me by making this choice for many reasons. The first, probably primary reason is that I get to spend more time with my patients. When I was a busy internist, and I think this is true unfortunately for a lot of primary care doctors nowadays, there was this constant push to see more and more patients in a shorter period of time. And there was a feeling that you were churning patients through your office, and I couldn't spend a lot of times an adequate amount of time with them as I would have liked to because of time constraints, insurance pressures, those kind of things. And I said, if I go back and specialize in oncology, I'll be able to give more time to patients. And now that, I don't feel rushed like I used to, and I feel like I can spend enough time with my patient and make them comfortable with their treatment decisions, and that's been very satisfying. And I really like the fact that I'm constantly being challenged, and the changes that happen in oncology. It's one of the most rapidly changing fields of medicine. Always new drugs and new therapies coming out, and things that we're learning on a daily basis. So keeping up on all that is very stimulating and challenging as well. There's never a dull moment in oncology, which is exciting too for me.